when we talk about cancer, and our physicians will elaborate more on this, there's different ways, obviously, to treat cancer. There's a lot of innovation, as Dr. Lynch alluded to. He's not just throwing something out when he says literally journal articles, new indications for drugs weekly. So these guys have a lot to stay up on. I just kind of wanted to highlight from the medical oncology perspective, so where we do immunotherapies and chemo, kind of some of the things that have been out recently that we're able to use and help us target certain mutations to help us treat, and then if we have anything coming in the future to be able to use to treat as well.
It's an exciting time to be an oncologist. Things are changing so quickly. There's just so many new things. Every week there's something new that comes out. And I don't know where to start as far as new things, but as far as lung cancer, we used to treat all lung cancers with chemotherapy. In this day and age, that's kind of an outdated system. Now we have immune therapies. A lot of lung cancer patients never even need chemo. They can start an immune therapy that boosts their immune system, and their immune system will kill their cancer cells. We have tyrosine kinase inhibitors, which are targeted molecular therapies that target intracellular molecules inside of cancer cells and will turn off the tyrosine kinases, which are, best way to describe them are, they're like little on-off switches that regulate reproduction of the cancer cells. So when you turn off these tyrosine kinases, the reproductive cycle is interrupted and cancer cells start dying. So people can be treated for various types of cancers by taking a pill a day at home that has minimal side effects. So, and every month or so, it seems like there's a new target that they discover, a new pill available for various types of cancers. I think for lung cancer, we have about 7 FDA-approved targets that we can treat with a pill. And there's about 7 or 8 that are already in the works. There's about 3 new immune targets that are coming out to treat cancer. There was a new drug approved 3 weeks ago that targets the NTRK mutation in cancer cells, and this is across the board, all cancers, that'll turn off the cancer cell. And this company actually says, if your cancer doesn't respond to our mutation, our pill, if you have that mutation and it doesn't respond to our pill, we'll give you a full refund for the pill. So the advancement is amazing as far as medications to treat cancer. Dr. Lynch can tell you more about radiation to treat cancer and different things that are involved there. There's new surgical approaches, new surgical treatments. We have Da Vinci surgeries now, robotic surgeries, to take out pieces of the lung without opening up the chest. They're doing Da Vinci surgeries for the heart. They're doing robotic surgeries for the colon, for the bladder, for the kidneys. It's amazing the advancements we are making right now in the world of cancer. I'll let you talk about radiation.
Yeah, our field continues to evolve and evolve. I was thinking the other day that when I first started in this, virtually nothing other than the fact that I use X-rays, radiation treatments, is the same as what I did back then. We have just installed a new linear accelerator, which is the treatment machine that we use, and we've been using it now for 2 weeks. And it adds to what we had been doing before in a more quick and accurate setting, basically. It's not that it brought significant changes in the radiation treatment, but it improved our accuracy and speed so that the patient's not laying on what's a fairly hard table for lengths of time. It also, we've got now on that table what's called a 6-degree of freedom tabletop, and so we can change their position after each day we get an image, a CT scan, and compare it to the CT scan they had initially, and overlay that to make sure within a millimeter or so they're in the exact same position each and every day. By doing that, we can decrease the volume of area that needs to be treated and know that we've got the cancer in there. If you make the volume smaller, that means normal stuff that's adjacent to the cancer is not getting treated. So that really improves side effects and outcomes, and it lets us be more aggressive with the radiation treatments. We also, with this machine, have expanded our stereotactic program, and it goes by several names. There's stereotactic radiosurgery, where you use a single fraction Oftentimes that's used on brain lesions or lung lesions. And then there's stereotactic body radiotherapy that's up to 5 fractions of treatments. And that can be used virtually anywhere in the body, but mostly we're using it in brain and lung and potentially liver lesions soon, spine lesions. But it's really expanded what we've been able to accomplish here. From the radiation world, about the only thing that we don't have available here at St. Bernard's that's elsewhere in the country is a proton machine. And that's because that's about a $300 million machine. So we're not going to have one of those in Jonesboro. So, but I'm very comfortable with the quality of equipment we've got here, and would match it up with any cancer center across the country.